Yeah. So back at it. So yeah, so now, so you're right. And then you can even see like there's a mustache here and everything. You can see it. You really can. So okay. But that was 9 weeks ago. At some point you gotta stop taking the Ozempic. Okay. And so right here, I think me personally, it's like stay right there, right? Maybe just stay there. Because you can't lose weight too fast. Like you can't. I mean, you can, but you don't want to do it too fast because you can become what's called cachectic. I think it's cachectic. Cachectic. Yeah, I gotta look that up, y'all. Some of the terms. It's been a while, man. I haven't used that term in a minute. You know what I'm saying? As time is going on, I'm really seeing the young guy. The hairline is very much receding. To the person who said that, you mess with when you keep messing with the hormones, you can have hair loss. The not only that, I forgot, rapid weight loss can make your hair fall out too. That is the thing. So can't wait for you to come home next week. Okay. Rapid weight loss. We'll look at that. We're gonna look at Ozempic and Ozempic face because this is a thing. So I would have always thought that Jazz would never really still like start looking like a man, and maybe I'm being naive. The body is quite extraordinary because you can't hide it. You cannot hide it. I mean, the makeup job, I will say Jazz has very nice eyebrows. Men usually do. They don't need them, right? We up here, like, let me tattoo mine on, but the men, they always have nice eyebrows and, pretty okay eyelashes, right? But the part that really, when I was like, what is going on, was this one, my guys, okay? I don't even know. I wish I could make this bigger. I can't make it bigger. Like, this is the one where I was like, okay, what is happening? Big belly equals cortisol is high. Yeah, the same thing that happens to me, driven by stress. It happens, yeah, poor sleep, hard to control when you are depressed or going through something life altering. Absolutely true. All true. All true. That's a fact. And that also happens to me too when I work overnight. So then my body, like, immediately is starting to like fluctuate and do crazy things. We're gonna look that up. So I guess we're having the Ozempic episode because I since I saw this picture, I was like, oh no, this is total Ozempic, and we're gonna look up Oprah too, who went crazy. He has a lifetime of medication trying to keep up womb pride apart. He calls a vagina, and he keeps trying to heal himself. Yep, yeah, and now you got me on IG expecting. Yes, I'm telling you, like, I'm just looking. Jazz was a work in progress. Well, of course, that's the thing. Of course, it's given man. Indeed, Jason Holt, what is up? Indeed, I pride myself on zero maintenance, manly eyebrows. I'm jealous, okay? Like, you don't properly digest food often leading to malnutrition. That is true because you're spilling it and everything. You're peeing out the sugar. It really is. So we're really gonna look malnutrition. We're gonna.
And as we will see, a common theme with regards to these side effects is that Wegovy is going to have the most side effects. And again, Wegovy is the higher dose formulation of semaglutide. Another side effect is going to be vomiting. So along with the nausea, we can have vomiting. This can actually be excessive and uncontrollable. Some reports suggest that there can be uncontrollable, excessive vomiting for many hours. Often patients can report having food regurgitations. So essentially they regurgitate up food that has been undigested. And again, this is going to be due to decreased gastric emptying in patients who have already an underlying gastroparesis, which is a paralysis of the stomach. So they already have issues with gastric emptying. Taking semaglutide in one of these formulations is going to worsen their gastroparesis. So especially when we're talking about diabetic patients taking these medications, if they already have 40 of the side effects, up to 30% on Wegovy can experience diarrhea. And we can also have constipation in other patients as well. And sometimes we can have both diarrhea and constipation that alternate. So constipation is going to be decreased insulin secretion. So it can actually secrete even more insulin. And this can actually lead to hypoglycemia, which is a low blood sugar. And we can see symptomatic hypoglycemia.
So like that, like I'm trying to get to like some of the stomach pain one. I want to look at the stomach pain. I'm not going to they have something about burping, flatulence, abdominal. So we're going to just look at the stomach stuff real quick. Yeah, we'll look at that. And oh, damn, they go into the hair loss too, guys. And Ozempic face, mood changes. All right, so All right, stick with me, guys. Stick with me. I know. Like, just stick with me. But this is really, really interesting.
Describe having severe diffuse abdominal pain. You can see these are the rates at which stomach pain can occur. And then another important side effect is heartburn or GERD, gastroesophageal reflux disease. So it's acid reflux, a burning sensation. And again, this is going to be due to food essentially sitting in the stomach. If there's anything that leads to the opening of the lower esophageal sphincter, because you have all this food content sitting in the stomach, you can have reflux of that food content into the esophagus, causing that burning sensation. And then here are, again, the rates of this side effect occurring. And there have been reported cases of a loss of bowel control being a potential side effect of these medications as well. So this loss of bowel control is going to be manifested as a bowel movement while sleeping. So patients are sleeping and they have a loss of bowel control and they can have a bowel movement during sleep. Again, these are anecdotal reports. Now, there are no official rates of occurrence for this, but there has been some anecdotal. We can also see issues with eructation. So eructation is burping. It's going to be burping. So we can see it again with Ozempic, but especially with Wegovy. And then along with these, we can see abdominal distension. So abdominal distension is a bloating of the stomach. So it's going to be a lot of gas buildup in the stomach. And again, we can see rates are generally low, with Wegovy being the highest. Now, these medications may cause other potential gastrointestinal and related issues. So there is a question of whether or not there's an increased risk of gastroenteritis. So this is an inflammation of the stomach and small intestines due to an infection. So there is some question as to whether or not there is an increased risk of gastrointestinal infections in patients who take these medications, and especially viral infections. And this has been reported with Wegovy use, and it hasn't been reported so much with these other medications. Now, these medications may also cause irritation and inflammation of the gastric mucosa, which is gastritis, so an inflammation of the stomach. So again, we can see rates for this, Ozempic, Wegovy, and the oral formulation Rybelsus. Again, Wegovy is going to be higher. And then cholelithiasis has also been reported. So cholelithiasis is going to be the presence of gallstones. So there may be an increased life of the gallbladder. Now, hair loss is also a potential adverse effect as well. This can be diffuse. It can be significant in some patients or long lasting. And it's only been reported with Wegovy use. So roughly 3% of patients.
Pause for a second because we're getting ready to get to the end of it. But all this stomach stuff, I'm telling you, man, if you're sitting there, you're not eating, right? You want to know what the infection is, I believe, that is happening in the intestine? Remember, after the person releases everything out, maybe they eat a little bit, right? But they're not eating that much, man. They're not. The acid is now, it is, like I said, it's breaking down in the intestine with like basically nothing there. So it ends up causing a trauma to the intestinal lining. Okay, allegedly in my assessment, you know what I mean? Like, I'm not there to tell, but it's more than likely caught because it's acidy. So now you're really in an acidic state. So, and then as that's moving, it's going to start causing trauma inside the intestinal lining, which trauma will give, of course, inflammation, because now the trauma that is an infection, because now your body is producing more white blood cells. You literally give yourself your own infection, but your body's producing more white blood cells to get to the parts of the trauma to clean out things. Because once you start cutting things up, there's bacteria everywhere, right? So like maybe your intestinal lining, all this little trauma, and then now bacteria is now seeping into the trauma areas that it's not supposed to be in. White blood cells need to go in, phagocytosis, everything is inflaming, and now you are doubled over, looking confused and wondering why you feel like you are in wretched pain, And we didn't even get into the black tarry stools, because if that's happening, these people are probably pooping out blood. Let's just intermittently fast. I think that it's just a better way to at least to start that way. All right, let's see what's up with the hair loss. They're going to talk about the face, and then they're also going to talk about the sight issues.
Patients using Wegovy may lose some hair or a significant amount of hair. And then another side effect that has been reported is what we call the Ozempic face. This has been reported in media. It's essentially a gaunt-looking face, a sunken or sagging facial features, and along with these features, wrinkles may look more prominent, and all of this seems to be related to a rapid weight loss of the face. So loss of fatty tissue in the face may lead to a sort of sunken, dragged out look to the face. This may be the reason why we see these facial features in patients who are on Ozempic or on Wegovy. So mood changes have been noted in some cases as well. These include depression and anhedonia. Anhedonia is a lack of ability to experience pleasure. These are going to be anecdotal reports. There's no reported rates of this, but there have been patients that have noted these changes. So this is something to look out for as well. And then increased anxiety has also been noted in some patients. More frequent or severe panic attacks have been reported. And again, this is anecdotal. Again, no reported rates, but this is something that patients have also reported as well.